So this is going to show us another case. I'll just pause this for a second. So this horse was presented as a middle-aged quarter horse, and it had a nasal discharge. So the idea was that this horse was coming in to have a sinus evaluated and potentially a sinusitis. When we performed the oral exam on this horse, we saw that the teeth in the 7 position here were kind of dysplastic. So you can see how the pulp horns are kind of crammed over towards the buccal side of this tooth, and then there was a production of cementum on the palatal sides of this teeth. Also, we had a missing incisor that we can see here. So kind of giving you a background on this horse's clinical exam. And so when we did performed a CT on this horse, and it was kind of interesting what we found and we confirmed with radiographs as well. But I want you to watch in this region right here. So we're going right down to the bottom of the occlusal surface, and now we're going to work our way up into the nasal passages. So we're going to see the apex of the 7s kind of leave here. And then as we go a little farther, we start to see an alien show up here, or some type of dental material density in the nasal passage of this horse. So what was really going on with this patient was there was a separate center of dental material, and you can see how the roots are ending here of the 6 and the 7. And the other thing I want you to, we just jump forward here with this a little bit, is I want you to notice the infundibula of these teeth as well, how big and gas-filled they are. Remember, 11% of horses will really, or 11% of the infundibula will be normal. So we're going to find a lot of gas and openings in infundibula. And the trick is figuring out, is the apex in trouble? Is that breaching through to a pulp horn? And so forth. So CT is really, in my opinion, probably the only good way to evaluate whether an infundibular caries is causing your problem. But the big issue with this horse is that the dental material that was in his nasal passage was growing bioslime, and that was creating the nasal discharge. We offered surgery to this client to remove this. The horse was performing well. Once they figured out that it wasn't a sinus infection in this horse, they're still considering this, but at this point have not opted for surgery. So just some stills of this showing the large infundibular caries in this dysplastic teeth here. And what I also want you to see is, look, there's a little tiny sinus cyst actually sitting in the rostromaxillary sinus here as well. So to just review, this is our sagittal of this horse, and we can see that cap of that material that we presume to be dental material. Without a histopathology exam on this material, we can't say for sure, but it sure looks like the density of teeth, both on CT and radiograph. And then we've got dysplastic teeth here, and then the dental material here. So the idea is that this horse probably somewhere in development had something happen where we got some of the germinal cells developing teeth that got pinched off in the nasal passage, and we formed this kind of odontoma looking structure in the nasal passage.